Today we're going to be talking to Dr. Dharmesh Patel, a board-certified neurologist and sleep specialist. Dr. Patel is a principal of Neuromedical Care Associates in Binghamton, New York, and he offered to spend some time with us today to talk to us about sleep. So welcome, Dr. Patel, to CoreLife, and in this regard, the CoreLife Challenge. Today, Dr. Patel, can you tell me a little bit about sleep and why sleep is important for the human body?
So I think more and more people are recognizing that sleep is integral to their health. They recognize in their own lives that if they're not getting good sleep, they're waking up tired, having foggy headedness is a common complaint I hear about, memory issues, fatigue at work, difficulty staying awake at work, etc.
Yeah, that's so recovery, restoration.
Yeah. Yep, there's stages of sleep you hit. Stage 3 of sleep, which is often referred to as restorative sleep, REM sleep, rapid eye movement sleep, which we're finding more and more there are physiologic changes during those stages, such as with your blood pressure, your heart rhythm, that are important in, that are important in helping you recover and feel better.
Yeah, to me it's interesting, having worked directly with you for many years, that not too long ago I had never heard of sleep issues. Like I'd never heard of a sleep lab or a sleep doctor or sleep disorders. And it seems like you have a career now seeing people that have sleep issues. So can you tell us a little bit why sleep has become more mainstream, more forefront, and why it seems to be there's more issues in it?
So we're recognizing that sleep disorders, and there are many different types, that affect various parts of your body, various organs. In terms of the central nervous system, we know data shows that in the short term it leads to memory issues. There are long-term consequences of dementia, white matter disease, increased risk of stroke, heart arrhythmias, heart disease. In regards to your challenge, we know that poor sleep, whether it's in terms of insomnia or sleep apnea, can affect hormones called leptin and ghrelin that directly affect your metabolism, your appetite, and thereby affect weight and weight gain. In terms of mental health, it's clear now that people don't sleep well, especially with patients with sleep apnea, do have increases in depression, anxiety. It aggravates their underlying mental health condition.
That's great. So you're using some sleep words like sleep apnea, and sleep apnea is this. What is sleep apnea?
So sleep apnea, in essence, is where one does not breathe enough in their sleep. So they have anatomical changes in their airway that leads to diminished airflow, drops in oxygen levels, increases in heart rate, blood pressure, and thereby you get a lot of light sleep. You don't get enough deep sleep. So patients will come in complaining fragmented, non-restorative sleep, and they'll have a lot of these consequences, which I already mentioned.
Yeah, which would be mental loss of focus,
attention span, multitasking difficulties. Some patients come with complaint sleepiness. A lot of them, high-functioning individuals especially, just complain.
So if I don't feel like I'm tired, I still could have sleep apnea.
You could, and sometimes in a high-functioning individual like yourself, it could manifest with difficulty multitasking and recall issues and memory issues.
So if I haven't seen a sleep doctor, are there things that I could look out for? Is there things that people that are taking the challenge or people that are just watching this video might say,
I think I would start with first prioritizing sleep. So if you recognize it's important, prioritize sleep, allow yourself at least 8 hours in bed.
So 8 hours is optimal?
Is optimal, at least to have a bedroom environment that promotes sleep in terms of appropriate darkness, sound insulation. You may want a white noise machine or an app on your phone with some background noise that helps you fall asleep. Yeah. And then a cool bedroom environment, a mattress that's comfortable. If you're a side sleeper, you want a pillow, a proper pillow that aligns your neck and your spine appropriately. And if you're doing all these things and you're allowing yourself enough time and prioritizing sleep and you're still waking up feeling tired, having cognitive issues, then you really should see a sleep doctor who can really analyze your sleep, look at your sleep architecture, and try to figure out what are those things that's fragmenting your sleep and try to address those issues.
Okay, that's really, really great. And sleep, I know you've said this, but sleep is directly related to performance.
It is.
So,
yeah.
So it's mental performance, it's physical performance, it's probably emotional performance, it's probably all of those things, right?
So it's cognitive, daily functioning, physical performance, as you said, mental health, and a lot of other organ systems that we're recognizing more and more.
Dr. Patel, is there, so sleep apnea I'm aware of. Is there any other sleep disorders that you see commonly that don't get the play that sleep apnea gets, that our viewer might have not heard of, but they should know about, and it might be relevant to them?
So most of the patients we see usually come in the fields of sleep apnea or insomnia, but there are other more interesting cases of parasomnias where people have motor behaviors, involuntary motor behaviors in their sleep, and often they don't talk about it because it's embarrassing. And so if you're acting out dreams, having sleepwalking, doing inappropriate things in sleep,
Yep.
then you should really see a sleep doctor.
And are
These
there
are treatable
they are treatable.
things.
And is sleep apnea treatable?
It's very treatable, and there are many options. Patients are often familiar with
The mask?
mask therapy with CPAP, and there are other alternative treatments as well.
And so, okay, we're almost done, but is the treatment of sleep apnea, the mask, I mean, can people actually get used to wearing that stuff? Like, it
They
seems
do.
to me
So
to be
it's
cumbersome.
a matter of finding the right mask, the right pressure settings. A lot of patients do need a lot of TLC, but if you really commit to it, you recognize the importance of why you're doing it, and you keep working with a sleep physician you feel comfortable with,
Yep.
usually you can have more than 90% success.
And if you don't treat sleep apnea,
Mm-hmm.
and it goes untreated, and you just say, "Not for me, not now," there are some
There are
real
long-term consequences.
consequences.
So a lot of these patients don't recognize it's not just about short-term gain, but in the long term, studies show, depending how bad your sleep apnea is, if it's severe sleep apnea, you can triple to quadruple your risk of strokes, heart attacks, heart arrhythmias. So those are some of the big things.
Wow. So for those of you participating in the CoreLife Challenge, part of the message of the challenge is that we're trying to offer ideas about how to take better care of yourself, starting with CoreLife Eatery as like a food place, changing diet, putting that as an emphasis. And then we speak into exercise and the importance of being active. And to close now, like kind of another little perk is, if you're not sleeping well, it really can have a long-term bearing on your health. There's a short-term bearing and a long-term. Dr. Patel, thanks for coming in. You did a fantastic job. Hey, good luck on the CoreLife Challenge, you and your wife.
Thank you. Thank you so much.
You're welcome.